Hi, my name is Gerard Reid. I'm a consultant ophthalmologist here at Cathedral Eye Clinic. Glaucoma is a group of conditions affecting your eyes and more specifically affecting your optic nerve. Progressive condition meaning we can have continued damage to the optic nerve, which ultimately will affect your visual field. Within ophthalmology, glaucoma is one of the most prevalent conditions, along with diabetic eye disease and cataract. There are many risk factors for getting glaucoma. There are causes such as a family history of glaucoma, previous eye surgeries, or other eye conditions which then have glaucoma as a complicating factor. Glaucoma often presents with raised intraocular pressure. Unfortunately, many patients will be unaware that their pressures are raised, and often glaucoma can go for many years undetected and therefore asymptomatic. There are many different subtypes of glaucoma, and occasionally patients will present with a red painful eye with very high intraocular pressures. Otherwise, patients would be picked up through screening at an annual eye test with their optician. If a patient is diagnosed with glaucoma, meaning that they have a visual field defect or changes at their optic nerve, this would be managed by minimizing the impact of intraocular pressure on the progression of glaucoma. A patient would take eye drops, usually once a day or possibly multiple drops per day. If drops are not working for a patient, at Cathedral Eye Clinic we are able to offer a full range of management options for glaucoma. Beyond medical management, we are able to offer selective laser trabeculoplasty, which is a laser treatment aimed at controlling intraocular pressure. And whenever these steps are inadequate to control a patient's intraocular pressure, we can escalate to surgical procedures. The surgical procedures that we offer include minimally invasive glaucoma surgery, which are small procedures usually performed at the same time as cataract surgery. And in more advanced cases of glaucoma, drainage procedures are required through trabeculectomy or aqueous shunt surgery. Clinical staff here at Cathedral will meet the patient on the day of their consultation, and they will have a visual field test as well as a scan of their optic nerve and retina. Following this, they will be greeted by myself or one of the medical team in the glaucoma clinic, where we can assess the results and carry out an eye exam. This would entail measuring intraocular pressure and assessing the drainage angle of the eye. Following these assessments, we would then put together a management plan for each patient, and this would entail a combination of drops or potentially laser or surgical procedures.